We look at Monteggia fracture. Okay, and this Monteggia fracture is basically a dislocation of the ulna. Okay, so you can have the Monteggia fracture, you can have the Gelazzi fracture. Gelazzi fracture is dislocation of the radius close to the wrist. Monteggia fracture is fracture of the ulna and is close to the elbow joint. Are you getting the differences? Galazzi fracture is close to the wrist, while Monteggia is close to the elbow joint. Okay, so Monteggia fracture is actually a serious injury and involves fracture of the proximal ulna. So when you talk about proximal, it's closer to you. So it's combined with dislocation of the radial head of the elbow. So it's rare, you know, but it's always important to know it and always diagnose it early. So the real definition is what fracture of the ulna, and this side is actually closer to you, with dislocation of the radial head of the radiocapitellar joint. It was first described by an orthopedic surgeon known as Giovanni Battista Monteggia. This was in 1814. So the mechanism of injury is usually comes in when there's fall on an outstretched hand. So forced pronation or hyperextension, okay, is what usually causes it. So it can also occur when there's direct blow to the forearm or elbow, usually when there's high trauma, like all those road traffic accidents. So they classify it using the classification which is known as the Bardo classification, and this is when you have the types: type 1, type 2, type 3, type 4. Okay, so type 1 is the ulnar shaft with anterior dislocation of the radial head. There's fracture of the ulnar shaft. Type 2, ulnar shaft fracture with posterior dislocation of the radial head. The radial head is going to the back. Okay, the first one, anterior dislocation, is going to the front. Okay, then we have the type 3, where there's what metaphyseal fracture with lateral dislocation of the radial head. So the radial head is not moving to the front, it's not moving to the back, but it's moving sideways. That's lateral movement. The type 4, there's fracture of the radius and the ulnar shaft. Okay, the radius and the ulna are getting fractured. That's to tell you that the how will I put it? The force that caused that was actually so large. Okay, so this is type 4. There's fracture of both bones. Okay, so clinical features is the person will be having a lot of pain. There'll be swelling there and deformity, and they'll not be able to use that part of the body like they used to. So the posterior interosseous nerve that passes along that path can also be injured. So you always check if there's injury to the nerves or injury to the blood vessels. Very important. So diagnosis include X-rays of the forearm. Then also the radiocapitellar line should intersect the capitulum. If not, the radial head dislocation is now confirmed. Okay. So management, if it's children, close reduction and cast. Just try to keep that place intact so that it doesn't keep shaking, so that it can heal faster. And also in adults, you do the open reduction and internal fixations using all those, nails and screws rather, you know. Then post-operative immobilization, after the surgery, they have to do a cast or splint so that that part of the body usually is the collar splint so that you don't keep moving it too much. So this is what we have, okay? So the complications, sometimes you can repair it, but it will not unite. Okay, so there's malunion, okay, elbow stiffness and instability. And sometimes if the place is not kept very neat, you can have infections coming in.